And to your point, one of the things that I want to really emphasize to people listening is how many people are given diagnoses that are like, it's genetic, not much you can do about it. And whenever that's the diagnosis, it's like, no, that's the doctor saying, this is what I know. Here's the medication. Here's the diagnosis. This is the way I know it to be. But then someone like you stumbles, into our lives and you're like, but wait, there's actually 20 million things you could do for this one condition.
Yeah, so there's never, I feel like there's a lot of opportunity, right? Always. You always have an option. So don't feel like you don't. And that's probably one of the frustrating things that people learn pretty quickly when they're dealing with a skin issue is that the toolbox, unfortunately, our prescription and medical toolbox is really not very deep for the prevalence of skin issues.
That's a lot of conditions. It's just like, where's the depth of the toolbox is really well said. So just so we're all on the same page, explain to me what eczema is. Like, how would you know you have it and what does it look like?
Yeah, eczema is just the name of a group of conditions that cause the skin to become red, itchy, and inflamed. There's a lot of types of eczema. It's really another name for atopic dermatitis as well. You'll use those terms pretty interchangeably. Contact dermatitis, which can mean some things, dyshydrotic eczema, nummular eczema. These are just different presentations. Seborrheic dermatitis, stasis dermatitis. So these are all kind of presenting in a little different angle or different form or shape or whatever. But in general, we're giving them all the same treatment. And so kind of setting the stage for eczema. And I know we're not necessarily, if you've got people who are in their 20s, 30s, 40s, whatever, we could all have kids. So if you've had children, you may have had kids, right? 10 to 20% of kids are affected, maybe 5% of adults. I mean, it could be less than that, right? Where are we getting kind of our data? And what will happen is sometimes you'll have it as a kid, it'll go away and it'll represent it as an adult, which I think has some meaning. So what do we agree about universally is that there is a staph infection, usually common present, not on every single time, but this is why I always ask for a picture. If the skin looks red, inflamed, angry in skin, darker skin, melanated skin, this can look more kind of pink and maybe even gray. So it's good to think about that because sometimes we get misdiagnosed with darker skin or melanated skin. So I always try to reference that it's not always this bright pink red, but if it's bright pink red and kind of angry, like oozing would be like the final straw, there's probably a staph infection present. So just one comment, it's kind of frustrating. Sometimes the provider will not culture for staph. So there can be a staph overgrowth or there can be fungal overgrowth. The staph cultures are supposedly a little bit better according to integrative derms that I've interviewed. So that's one thing. And also a lot of times it comes back accurate, but no test is perfect. So sometimes it'll come back negative and people still respond to things that would work on topical staph. So what's that tell you? You got a topical staph issue. So just like to put that out there. That's one thing we do kind of agree on universally, that eczema does have a topical staph component. But what you got to think about then is, okay, where's that come from? It grows from the inside out. So you'll see like illnesses and things really cause relapse. I would say people do not make progress when they're sick, right? They've got overgrowth of things and then that'll show up to 3 weeks later. So that's a little fun curl that you can not have an issue and then you can have an illness and 3 weeks to a month later, you'll have a little bit of a skin presentation. Why do I know that? Because it's happened to me. Right. And so, and clients commonly. So just throwing that in there, that was more of an answer than you were asking, but I just want to set the stage of like what we kind of agree about or the big picture on eczema.
So no, it's that one of the things that I really talk about in my Reset Academy with the members over there is that when we hear information like this, if we put it into an old paradigm, the paradigm of give me the quick fix, give me the diagnosis and everything's going to go away, we're only setting ourselves up for failure. And what I love about the context you just gave is that, and what I'm hearing is that there's a new paradigm in which we need to look at this. And if staph is the source of it, then my brain goes to, well, what are the other symptoms? Like if we have eczema, that is the outward expression of it. Are there other symptoms that we would see in our body that the staph infection is affecting?
Yeah, well, absolutely. And this kind of makes me want to stand back. I want to answer that question, but I kind of want to stand back and talk about all the ways it can present or what you should prioritize a little bit as well. Let me start with staph. I mean, that could look like, what are some other common things that you'll see? Could be anything, right? This is where I really recommend as a starting place, because what we see is like, oh, I have terrible eczema, but I may not be thinking about these other things that are not a diagnosis, right? And so I always ask people to Google multiple symptom questionnaire or symptom survey online and just fill that out really honestly, because you might notice that you have a bit of congestion. You might notice that you have some throat clearing after a meal, which can be kind of like a little more fungal in my opinion. You might notice that maybe I'm not having a bowel movement every single day consistently, which by the the way, the skin is one really easy way your body detoxes. So we can talk about mechanisms of detoxification,
Yes.
which is important. So this is why I think the bottom line with eczema is that we want it to be simple. We want it to be topical, and it's actually twice as hard. It's internal and external. That's the main piece that you need to know, is that it's internal and external. So you've got to support the topical skin barrier. So I was telling you kind of offline, sometimes I look at any condition. I'm like, okay, how can we address this from different angles? And so there's this health triad, right? And so you can if you imagine a triangle, you can pretty much put any condition into the triangle and say, what are the angles I can fill in? So there's the structural or external. And so with the eczema, it's like, I've got to support the skin barrier. If it's broken, fix it. Like, it is not, you're going to have more stuff coming in. And so something that happened in the last couple of years that might be of note or interest is that we use so much alcohol hand sanitizer. We disrupted our topical skin microbiome on our skin.
Thank you. Yes.
So we created a structural issue, right? So what's supposed to happen is our skin has this phospholipid layer, right? It's got this naturally antimicrobial fatty acid layer on the top of it. And so when you continually strip that off over and over and over, you screw with your body's ability to combat things naturally. And so then you allow things to come in and like set up a new environment or microbiota on the skin, and then it can get like kind of out of hand, right? So if the skin barrier is broken, whether you've got acne or eczema or whatever, you've got to try to heal the skin barrier as quickly as you can. There's a bunch of nourishing nutrients. Some things I like to do is there's a bath salt that's got silica. There's different topical MSM, and those things like help heal the skin a little faster. There's different topicals that'll help heal the skin faster if you can do this. There's actually so many angles we could talk about this from, because when you're imagine that you do have a topical staph infection. What are some of the issues? Well, I've got to control the staph. I've got to support the skin barrier from breaking down, and I've got to clean my skin, right? So there's 3 different angles that you can do just from a topical perspective to support that area, depending on what it's kind of looking like.